Member for Kamloops North Thompson.
Thank you, Mr. Speaker. Time and again, we hear in this place about the toxic work environments within health authorities and within individual health facilities, from doctors, from nurses, from all sorts of health professionals working in those facilities. Time and again, this minister brushes those concerns off. That type of an environment gets fostered from the top down, Mr. Speaker. We've heard how people that are raising issues get threatened with muzzling, threatened with suspensions. So let's
go talk to a nurse for crying out loud.
So Mr. Speaker, let's look at why those healthcare professionals feel that that is happening. And let's see what happens if you're in administrative side of healthcare and how this government and this minister treats you. Dr. Albert de Villiers, the former Chief Medical Officer for Interior Health, has just been convicted of sexual assault and sexual interference of a child. He's still awaiting trial on a few more charges for different incidents. It's extremely disturbing to everyone to learn that after he was charged in June 2021, he was allowed to return to work on October 4th, 2021, where he continued to collect a six-figure salary. No suspension there. Under this government, hardworking doctors and nurses that speak out are facing swift justice and suspensions, but a vile criminal like Dr. de Villiers was simply reassigned and allowed to continue to work and receive pay. Mr. Speaker, to the Premier, why does the Ministry of Health continue to foster a toxic healthcare workplace by muzzling and suspending frontline doctors, nurses, and healthcare professionals while protecting employment of administration accused and then convicted of something as egregious as sexual assault of children?
Dr. de Villiers has been convicted and he no longer works for Interior Health, as appropriate, Honourable Speaker. And the members asked questions about the case of another doctor and have, I think, put into question the ethics of a senior doctor whose responsibility it is to protect patients. That is always what our senior doctors do in British Columbia. And I think to attempt to juxtapose those issues is disgraceful. We have taken steps, Honourable Speaker, repeated steps. You know, Honourable Speaker, they think, Honourable Speaker, they think that asking these questions of this seriousness requires heckling, Honourable Speaker. It does not. It does not, Honourable Speaker. It requires... Here they go again, Honourable Speaker. Dr. de Villiers rightfully is gone, Honourable Speaker, as he should be. With respect to... Honourable Speaker, as noted, Honourable Speaker, people do have the rights, Honourable Speaker. People, of course, do have the right, will always have the right to speak out in our democracy, and that right has been assured by legislative action of this chamber, and they will continue to do so in our province as they should. Honourable Speaker, in our public health care system, Honourable Speaker, well, the member is just wrong. He's just wrong as to the facts. And to make such serious allegations when you're wrong speaks of the opposition and not the government, Honourable Speaker. We have... Honourable Speaker, people watching on TV should know that they're just heckling away, so I'm just waiting for them to stop, Honourable Speaker. I think, Honourable Speaker, Honourable Speaker, we expect our public health officials to act with the highest standards, and they do, Honourable Speaker, and we will continue to support people who need care in British Columbia with unprecedented measures to do so. But we'll also support when people are doing their jobs, like Dr. Ben Williams. We will support them in their efforts to protect public safety, and will continue to do so.